There's a company called Synchron, which actually beat Elon Musk in this race to test brain chips. The CEO is Dr. Thomas Oxley, and he joins me now. Doctor, you have FDA approval for this interface between a computer and your brain. I think this is a big deal. How do you get a computer to talk to your brain? Can you explain it in layman's terms?
Thank you. Brain-computer interfaces are a truly revolutionary technology that promise to transform lives of millions of people suffering from paralysis. So it creates a direct connection from the brain to control external digital devices that improve independence.
So hold on a second. I've got a computer, and you can link it to my brain, and you can tell my brain to make my left leg move or my right leg move. I mean, can you do that?
Well, your brain right now is telling your hand to move. Once we digitize that signal directly out of the brain, we can then turn that into a command signal.
Wow. This is a real... It seems to me that this really is a breakthrough. Are you a public company?
We're not. We did our Series B led by Khosla Ventures a couple of months back.
And are you thinking about going public at some point so people like me can get a piece of the action?
We've got a fair way to go, but we have just received the first green light from the FDA to commence clinical trials in the US for a permanent implant.
Okay, so what are you trying out in America?
So the implant comes into the brain through the blood vessels. The blood vessels are the natural highway into the brain. So 1 million heart catheterizations are performed each year in the US, and it's like that. It's a safe and accessible way for large-scale adoption of our technology, and we're going to begin to test that towards the end of the year.
Can you give us any kind of time frame as to how long it would be before we can actually get these brain implants that work with people who really need them?
Yeah, the FDA is leading globally on what the pathway looks like. We are moving along that pathway, we think, pretty fast. We think we can be into market in 3 to 5 years.
3 to 5 years, okay? Dr. Oxley, what you've done is spectacular, and we wish you the very best of luck and the very best of success in the future. Congratulations. Please, you've got to come back and tell us how you're doing, because this is a very important thing for millions of people. Thank you, Doctor. We hope to see you again soon.